And thank you all for joining us today. With me is Richard Fields in the middle, John Cameron on the end, and I am your host, James Just. Gentlemen, coronavirus ethics are a issue on table today. There's an article out of Canada where ethicists are debating whether anti-mask protesters should forfeit their COVID-19 medical care. So much for medical care being a human right. I guess it's only a human right as long as you do what the government says you should do.
Well, it's interesting. The story should come out of Canada, where all healthcare is nationalized. When you have one provider, one mandatory provider, and no choice in the matter, then you can make the ethical, quote unquote, case that if you don't follow our orders, you don't get to partake in what we're providing for you. But the problem, of course, is not the fact that it's people are wearing or not wearing masks. The problem is national health care and giving people no choice in their medical decisions. In a country like ours, theoretically, where you have a choice of medical care providers, you can go ahead and protest by not wearing a mask or not social distancing or whatever. And as long as you can find a healthcare provider in the free market that's willing to provide the hospitalization or services that you need, no problem. The problem is the monopoly model of healthcare in Canada.
Well, I would say that we really don't have a whole lot of choice here. I mean, you do have choice. That you have a choice to go to a limited or unlimited number, a number of providers, but these providers are all part of a government-sponsored monopoly. If you want to see a physician who isn't licensed by the one licensing agency in their state and in the nation, who hasn't gone to an accredited school and gone through their series of tests and all the rest of this, and this person tries to practice medicine, they'll be guilty of a felony and could be put in jail and fined and all the rest of that. And then they'd never be able to carry a gun to protect themselves from nurses. No, I didn't say that out loud. So we don't really have, I don't think we don't have free market health care here. And what I'd like
I mean, that's why I said theoretically. We have a little bit more freedom than Canada does, not a lot.
Well, the Canadians,
the question is whether or not, the total lack of actual statistical evidence that masks work or that social distancing work. There is very little, and there's a lot of evidence that it doesn't make a whole hell of a lot of difference. Take a look at Taiwan, where there is no mask wearing to speak of. There's no social distancing to speak of. They have less than 1,000 fatalities in the entire, all year long. Look at Sweden, which is about the same as other similar countries in the European Union in the Western world. There's just, take a look at Argentina, which has, and India, which have onerous masking requirements and social distancing, and you can't even go from one province to another in many of those countries without special permission, and they have really high rates. You can make those, that's anecdotal evidence, but if you take a look at the statistical evidence, there's nothing to indicate that the whole premise that mask wearing and social distancing has any effect at all. It doesn't hurt anything, and I go ahead and do social distancing and mask wearing, mainly because I just don't want to deal with the fear that other people who believe in the protocol might have. But there's not a whole lot of evidence that it actually does anything.
Well, I'll do the story about Richard and I went out to lunch, and we asked for, at the end, Richard had to go to an appointment. And at the end of lunch, we asked for a check. And then Richard said, I got to go. And he threw some money on the table. Too much money, Richard. I owe you a couple of drinks. And no check. So I asked for a check again. No check. I asked for a check again. No check. Well, our waiter wasn't wearing a mask. Our waiter was wearing a visor. And he came over and said, there's been a horrible mistake, and I need to apologize, and I'm so very sorry. There was a complaint that about me wearing a visor from a table, and I thought it was your table, and I handed you off, I thought, to another waiter to take care of you, but apparently I didn't do a good job. So I'm so very sorry about, about the misunderstanding. I'll knock something off the bill. And then I said, fine. And so he knocked something off the bill, and the bill ended up being less. So now there's enough money to buy Richard half of his daily alcohol drinking requirement. And
well,
so
you don't know what my drinking requirements are before you.
well, I can always pitch in a little bit. We'll go into the change jar. So, and I apologized to the guy. I said, well, I'm sorry for the stupidity of the world at this point. And I told him that I call this thing the panicdemic, and not the pandemic, and that he could steal that line, but if he got rich off of it, he had to cut me in for it, since I originated it. And so it's just, I see these examples over and over and over again, where I see people out walking on the levee, on their walk, in a 30-mile-an-hour north wind right now, wearing masks. And there's nobody within 100 feet of them. And I'm trying to think what logic they're using to wear these masks. Now, of course, with this north wind blowing, I have allergies, so a mask would probably help. And I didn't think of that on the walk this morning. I got a terrible sinus headache. But from a perspective of saving yourself from a virus that has a real IFR, an infection fatality rate of about 0.4%, unless you're very old or have some comorbidities or get a huge amount of viral load when you get infected by it. It's about the same for people who could really are at risk groups of H1N1, which wasn't that bad anyway. And we didn't shut down the world and shove 150 to 250 million people into the worst kind of poverty, which is less than $2 a day, and literally at best 50 million of those are going to die in the next 2 years. I mean, it's insanity. And that's where the real ethical dilemma comes in. Mm-hmm. Yeah, you might, theoretically, if you buy the theories that masks actually work, you might save a few lives by wearing masks and social distancing, but at the cost, as you very correctly pointed out, of millions probably dying of starvation because of the economic impacts. That's the ethical dilemma. Tens of millions.
That's the ethical dilemma. And that's an ethical dilemma that nobody is addressing. Nobody in a position of power is addressing. Well, it's real easy for politicians and doctors to have a single-minded focus on preventing all harm that would come from the virus, while ignoring all harm that's coming from the knock-on effects of the policies they're prescribing.
Yeah, well, let's talk about some causing some harm. Paul Krugman, one of our favorite people.
Yeah, he causes harm every time he opens his freaking mouth. Sorry, go ahead.
He said holding a religious service is the same as dumping neurotoxins in public reservoirs. And so apparently he's got this notion that if you violate the ethics of walking around without a mask, going to your religious service, you somehow no longer have that basic human right. That you're it seems to me that these people are just starting to justify the mass violation of basic human rights. They're trying to.
Well, yeah, I mean, they're saying because of the virus, the Bill of Rights is repealed. That's the limiting the number of people to 1 or 10 people in 1,000 capacity church. That's essentially saying that you no longer have freedom of assembly, you no longer have freedom of religion, etc. I mean, 2 strikes in the First Amendment right there. The fact that Amy Coney Barrett ruled along with 6 others on the U.S. or 5 others, I guess it was, on the U.S. Supreme Court to strike down that horrendous violation of religious liberty that's what's got Krugman panties in a bun. And they, it's absolutely insane the amount of civil liberties that we're willing to give up because we're afraid. Now,
I'm not willing.
I don't think that it makes a whole lot of sense to be singing in a choir in close proximity at a Baptist church. It's not something I would do, but I don't have to go. And the people that want to go can go. The people that don't want to go, nobody's pushing them.
What is that Latin phrase that let the buyer beware? I mean, it's we this nation was founded on the principles that people have inalienable rights, and some of those rights were spelled out in the Constitution of the United States and some amendments, but the rights that weren't spelled out still exist. They're just not spelled out. It's not that if it's not spelled out, you don't have this right. Basically, you have the right to do anything unless, you get together as a group of people and vote to give that right up. And we're not voting to give it up. The thing that bothers me the most about this whole craziness is that the solutions are all command and control driven solutions. And the fix to the problems caused by the command and control solutions aren't freedoms. They're more command and control solutions, which cause even more problems that demand even more command and control solutions. If I believe that people who've assumed power, and I call assumed power because what they're doing, there's no constitutional support for what they're doing. They're just doing it and waiting for people to stop them. If they were smart enough, I would think cabal, I would think plot, I would think coup, because basically it's the same thing with global warming we talked about. There's this boogeyman that everybody pays lip service to as being a fact that allows these government organizations to take people's freedom and just crush them. And that's the thing that bothers me the most. These boogeymen that they keep pulling out of their pocket. Let me be kind and say pocket that they use to take away freedom and impose greater and greater government controls. And that's what bothers me the most about it, quite frankly.
Yeah, well, I think after 9/11, we surrendered a lot of our civil liberties out of fear, and I'm afraid we're doing it again. C.D.C. says that most Americans have been wearing masks since spring. Over 80% have been wearing masks since spring, and we've got this hysteria that people aren't wearing masks, but yet they are. And we don't talk about the consequences. In Japan, more people died from suicide in the last month than from COVID all of 2020. And Japan's got a fairly high suicide rate to begin with, but it had been on the decline, and so now it's spiking again. And we don't talk about the unintended consequences of all these actions. Some of us here have been screaming about it since day one, but the talking heads and the political class, they don't seem to care about the deteriorating mental health of the people they're supposedly represent. I guess dying from COVID is more important than dying from despair.
It's a totally ignoring trade-offs. And I think, to be honest, I think a lot of it was inspired by get Trump out of office at any cost. The coronavirus presented a perfect opportunity for the left political class, and that's that's most of D.C. Certainly most of the regulatory agencies provided them a golden opportunity to make Trump look bad. They succeeded. And now they can't very well retreat, at least not make a hasty retreat. Otherwise, it will look like they're as hypocritical as they are. I predicted that the vaccine would arrive after election day. It did. I'm not predicting that the coronavirus will be magically not an issue anymore after inauguration day, and I stand by that prediction. Once it becomes clear that this evil genie out there is not all that dangerous, that it's kind of the man behind the mask, the evil empire, the guy in the Wizard of Oz,
the guy behind the wizard behind the curtain.
Yeah, the guy behind the curtain isn't quite as dangerous as everybody thinks. Once that becomes really obvious, and it eventually will, then the political class will say never mind. But the problem is that people will have been inoculated or will be used to blind obedience to the dictates of doctors. We're blindly obedient to the dictates of security experts when it comes to the response to 9/11, taking off our shoes at the airport and subjecting ourselves to body searches and so forth and so on. Now we're subjecting ourselves to the worst fears of the most paranoid physicians that we can that exist.
Well, Barrington Project, there's, I think one of the, well, I don't know, James, you're in charge, but I think one of the things that's happening is more and more people who are educated medical experts are saying that these lockdowns are doing more harm than they're worth. And, I'd like to talk about that at some point, that the experts are actually coming around.
Yeah, well, we've got the next story on our list is out of the BBC. The coronavirus, the health experts are joining the global anti-lockdown movement precisely because of the unintended consequences. The mental health experts, the people not being able to access medical care, which is one of the reasons why our ICU beds are full. Out of North Dakota, they try to say the North Dakota ICU beds are full, and the governor had to come out and say, but only 20% are COVID patients. The rest are people who have been putting off medical care and now all of a sudden are in emergency care. And so there's unintended consequences of these lockdowns. And if we have this target fixation, we lose situational awareness and become dangerous to ourselves. I think that's,
I think the phrase unintended consequences is a little bit misleading. I don't think there's so much unintended as we don't care about these consequences because we're interested in getting the orange-haired guy by any means necessary. Now, I'm not a fan, as anybody knows, of the orange-haired guy, but I do believe that we should have fair play in politics. We should not use fear of disease as a political weapon, and that's what was done. Disease was weaponized in the 2020 campaign.
And something else is going to be weaponized again. You saw it in the green religious movement. That's weaponized as a political tool, making people afraid of the earth turning into a cinder, global warming. And since that didn't pan out, they had to do climate change and all the rest of that. And I still say the next bogeyman is going to be fear of alien invasion, because nobody can do any. You can pull those numbers out of your ass. Sorry about that. Out of your pocket and make them jump through whatever hoops you want to do. And, there's literally probably tens of thousands of science fiction books written about it. But I predict that's going to be the next major bugaboo that they'll use, or else the imminent collision of a planet-busting asteroid. So we need to decentralize and go back to an agrarian economy and whatever it is. It's as Richard repeatedly says, people using fear to force people to give up freedoms, or using fear and taking their freedoms, and citizens being of good nature. Most people are good-natured. They don't pick up arms and go down and shoot the nearest local politician. And I'm not saying that we should do that. But it's that I more and more I agree with Richard's basic premise that all politics now is fear-based. Whether it's on the left, it's fear of people using guns, even though I think last year 2.1 million people used guns to prevent crimes, and they look at 15,000, really the real number, 15,000 gun deaths. So it's on and on and on. Let's use fear to take people's freedoms away until the Supreme Court steps in and stops us from taking freedoms away.
If they can get enough guts to do so. I mean, it's still Justice Thomas, supposedly, or not Thomas, Justice Roberts, supposedly a conservative, was on the wrong side of the religious shutdown order. And we've got the threat of court packing, which essentially hangs on whether or not the Republicans continue in the Senate, which hangs on 2 Senate elections in Georgia. And from what I hear, there are people moving from California to Georgia for the express purpose of voting and then going back home.
Yeah, they've created a whole big mess out of this whole voting thing and this election our team spirit is more important than our national spirit. And it's kind of depressing. But talk about depressing. The IRS sent $1,200 stimulus checks to non-Americans overseas. The guy in, I think it was Ireland, got his $1,200 check. He says he went and deposited it right in the bank. He says, you're not getting it back because why would you send it back?
Well, I know.
Yeah, I mean, you've got people in overseas, you've got people there's a whole scam in California with prisoners, including famous prisoners who milk the system for the $1,200 checks. And I didn't get one. I'm feeling left out.
I'm not going to say on air whether I got one or not.
The problem is that the only reason why $1,200 checks were even a thing was because of the lockdowns, which was an inappropriate and terrible response to the COVID problem in the first place. Nobody here is saying that COVID is not contagious. It's highly contagious. Nobody here is saying that it doesn't kill people. Mostly people who are sick with something else already. Those are the people who die. I think the old is kind of just coincidental. People who are old tend to be sicker. So I think the fact that old people die is because they already have more comorbidities than 20-somethings do, or kids. So if you're sick, if you're already dying of something anyway, COVID can be the straw that breaks the camel's back. It's a coup de grace illness more than anything else.
Yeah, I want to add.
If you're healthy, I've got I've got a niece, a nephew, a future son-in-law, a number of other people that I know personally who have had the coronavirus and have either been asymptomatic totally or have had maybe a week's worth of serious flu symptoms. Those are the people, and that was somebody who was obese, so he had one comorbidity. So the thing is, if you don't have comorbidities, it's a nothing burger. If you do, stay inside, wear the mask, and social distance, and wash your hands. Do all the things that they're recommending. But if you don't, forget about it. You're really not at any more degree of risk than you are from the flu.
Well, and I'll add to that. But Richard reminded me that age in and of itself isn't a comorbidity, because there's a 103-year-old woman in Scotland who survived the Spanish flu and the coronavirus. There's a couple 100-year-olds here in the U.S. who've done the same thing, and healthy, sturdy stock. And then we look at, I don't know, I follow sports, complete waste of time, I know, but there's all sorts of people in the sports world. These are young athletes who are catching the coronavirus, and within, they're testing positive for it, and most of them end up being asymptomatic, and the ones that do have symptoms are back playing football at a professional level, which means basically mutant strong, mutant fast, playing against other mutants within weeks. So it goes to the point over and over and over again that if you're healthy, unless you get a huge viral load, which is what happened, why a lot of very healthy health workers got deathly ill at first, is because they weren't aware of the lung problems associated with disease, and weren't careful enough when they were treating people who were just spewing the virus, and they got a huge viral load. Like any other disease, you get a massive viral load of it, you're going to get sicker. You get a small viral load, you're going to get less sick. So point taken, probably time to move on.
Yeah, well, talk about moving on. Here in California, the D.A.s, California district attorneys, local county district attorneys, are warning that we've spent over $1 billion to people outside the state in our unemployment system. Calling it a system, I'm not even sure. But yeah, we're going to go lock down people again and put more people out of work.
That's in addition to the $1 billion that they gave to prisoners. So you're paying.
Yeah, and the whole prisoner thing is they didn't even go to prisoners. They went to people who are pretending to be prisoners. The whole thing is a complete mess. And of course, so they're going to try to navigate. Right? They're going to command and control our way through this coronavirus when they can't even command and control the damn EDD system. It's outrageous that you think they can manage this when they can't even manage their own left pocket.
Well, I don't even know how to balance it. If you can't balance a checkbook, how can you possibly run anything?
Well, they're still running off of 1970s equipment. I swear they're still using cobalt over there.
Cobalt, yeah. And actually, you talk about waste. I think the EDD, if you count the time cost of money, over the years has spent over $1 billion trying to get their computer, the EDD and DMV combined, trying to get their computer system cleaned up. A couple of different times, they've spent $100 million chunks of money, thrown them at computer experts and consultants and all the rest of that. And they
Yeah,
still have
they're still upgrading to Fortran.
Yeah. Yeah. Well, I suggest if they just used an abacus, they would probably be better off, but that's just me.
Yeah, I wouldn't be surprised if they're still using punch cards in a strange sense. But the whole technology upgrade of the state is actually awful. They don't do the front end work. And so they end up spending a bunch of money on the back end, and then the system doesn't work and they throw it away and the whole money gets flushed. Rather than call up Microsoft, Amazon, Google, and Apple and say, hey, can you guys bid out just taking care of the whole thing and hiring actually the best company for the job? They've got to meet all these goofy requirements for purchasing, and then all the and you end up getting some fly-by-night company that's got more political contacts than technical contacts trying to do a contract to redo the whole dang Department of EDD, and it fails because they don't do the front end work. And
well, they do all the front end work on political glad handing. The people with the biggest bribes, I guess you don't legally call them bribes, so you can't write a bribe off on taxes, but they do. The people with the strongest lobbyists and who write the biggest checks get the jobs, and it's thus it has always been, thus it will always be, and we're getting ready for 4 years of it that it's already disgusting. I mean, these packages they're proposing to like the economic stimulus, I think we should call them slimulus, that they're just giving their friends money and not giving their enemies money.
Well, and we didn't talk about it. It's not on the agenda, but I mean, taking a closer look at the Biden cabinet picks, we have a couple of warmongers. I mean, literal warmongers of the worst kind at defense and at Secretary of State. We've got a couple of inflationistas at Treasury, and already at the Jerome Powell at the head of the Federal Reserve. We are looking at feeding the swamp critters more than they have ever been fed before over the next 4 years, without question. I'm talking about the military-industrial complex. They're going to find more wars to fight and more unwinnable wars, but enough to keep the Pentagon in high clover. They're going to find more stuff to do that backfires than we have been that we saw even during the Bush and the Obama administrations. And likewise, we're going to see more inflation.
And that's all the time we have. There's a reason people in non-competitive races are still raising hundreds of thousands of dollars. From those of us here at Libertarian Counterpoint, please visit us at libertariancounterpoint.com and find us all on social media. Thank you for watching, and goodbye.
Brian, thank you very much. I appreciate the